Okay, so thanks to everybody who's joined us on this call today. Really appreciate you coming. Basically, we are going to be, it's going to be quite an informal session. I'm Sue Jane, I'm the Community Outreach Officer, and I'm usually out and about at meetings and seeing local people and groups, not just a face on a screen like I am today. Hopefully that will improve in the coming months. So for those of you that don't know us already, Healthwatch Enfield is a community interest organisation providing a number of free services within Enfield. Signposting being one of the important ones, which is a public service, a one-stop shop, if you like, for information about health and social care services in Enfield. We do research, we engage with local communities through surveys and events to collect your views, opinions and experiences of using services in Enfield. And we present our research to service providers and work with them to help improve and promote their services based on your feedback. So today we're talking about children and young people's mental health and meeting some of the people who run the different services within Enfield, finding out what they offer and about what future plans are as services respond to the different needs within the community as a result of the impact of the pandemic. They are experts, so I'll leave it up to them to talk more about that in a moment. We have a mix of directors, chief executives, and other professionals from a range of services, including CAMHS, and I'll explain what that means. It's Children and Adolescent Mental Health Services, Mind, the mental health charity, Wellbeing Connect, a charity for individuals who have ethnic descent or ethnic minority groups, Enfield Carers Centre, Kooth, which is an online mental health charity for young people, and education and psychology experts from the local authority. So, just to let you know, we've explained how the session will run today. I must emphasise this is an open meeting, so only general information will be offered with signposting and support links in the chat box, so do check that out. We'll start with a short introduction from each panel member that will take about 20 minutes or so. Then we'll read out questions you sent to us at the time of your booking, or you can ask these yourself if you've opted to do so. And our panel members will ask questions according to their areas of expertise. We're going to do our best to keep the conversation free of jargon, and we'll encourage you to please type in the chat box if anything is not clear, and we'll help clarify as we go along. Likewise, type any additional questions in the chat box as we go along, and we'll try to get to these after the pre-submitted questions if we have the time. This is a very popular topic and we have a lot of questions already submitted to us, so we'll get through as many as we can. We plan to finish on time at 12:30. And just want to say this has been such an extremely difficult year for parents, wearing numerous hats, juggling parenting, work, keeping the children entertained, homeschooled, as well as everyday life. So it's important to reach out for help if you or your child needs it. So let's move on to the speakers. I'd like to start with Nicholas Clark, who is consultant clinical psychologist and Enfield CAMHS Child and Adolescent Mental Health Service clinical lead. Hello, Nick. Would you like to wave and introduce yourself, please?
Hi, good morning, everyone. I'm Nick Clark. I'm clinical psychologist and clinical lead for Enfield's CAMHS, which is the Child and Adolescent Mental Health Service, which is part of the NHS.
Thank you, Nick. And I'd like to introduce Clive Blackwood, who is his colleague as well.
Yep.
Hi, good morning, everyone. My name is Clive Blackwood. I'm the Senior Service Lead for Child and Adolescent Mental Health Services and also the Senior Service Lead for Children's Therapy Services within Barnet Enfield and Harrogate Mental Health Trust.
And a special thank you to Nick. He's given us some fantastic links, actually, that we're going to put in the chat box later. So thank you for those, Nick. That's much appreciated. And perhaps you can go on to Michael Salfray, please. He's the service lead for CAMHS.
Hi everyone, I'm Michael Salfray, the service lead for Enfield CAMHS. I'm a mental health nurse by background, and I oversee the operational management of all the teams within Enfield CAMHS.
So Nick, did you want to just explain a little bit about what CAMHS actually is, please, and what it does?
Yeah, so CAMHS is a specialist children and adolescent mental health services. So predominantly staffed by psychology or psychotherapy and family therapy clinicians across the services, across the teams, providing specialist input and assessment and treatment for children and young people. And yes, so at the moment there's 9 teams within Enfield under CAMHS. The majority are the higher level of needs, so we use a 5 partnership model. So the majority of the teams are highly specialised teams. The team which traditionally which we call tier 2, which is a bit lower level, is the mental health support team, which is the teams that go into the schools, and they're relatively new, just over a year now we've had that team. I don't know if that's helpful or more information, but yeah.
No, that's great, thank you.
Okay.
And what we've done, Nick's kind of given us a fact sheet as well that we can actually put a link into the chat box so you can see exactly what they do and how it works. So that might be useful to have a look at that later. Thank you very much. And I'd like to move on to Tristan Eddins from Kooth, please. That's an online young people's organisation, sport organisation. Thank you, Tristan.
Hi, yeah, as I said, I am Tristan and I am the Kooth engagement lead and one of our practitioners at Kooth for Enfield. And so Kooth is a free, safe and anonymous online mental health platform that is commissioned by the local NHS. So young people 11 to 19 have access to this, and it's completely anonymous and we're available 365 days a year.
Fantastic. We'll make sure that we put your link for Kooth in the chat box as well. Thank you, Tristan.
Thank you.
And Alex, I'd like to move Alex Tamborides, the Chief Officer for Mind in Enfield. Perhaps you'd like to explain your services, please.
Yeah, hi. So I'm Chief Executive of Mind in Enfield and Barnet now. We actually merged into one organisation on the 1st of April. Mind in Enfield was established in about 1995. It's one of 120 local mind associations that are all affiliated to National Mind. We're all different. We're all completely sovereign. We have our own boards, our own services for local people in boroughs, and mainly staffed by local residents as well. And I guess Mind in Enfield is a specialist mental health charity in that basically mental health is all we do. We don't do anything else. That's so every single thing about us, our policy, procedure, line management, staff support, everything we do is about mental health. We try and improve the lives of people with mental health problems in 3 different ways. One is providing services to and with people with mental health problems. The second is campaigning and influencing. So if we're not providing services, we want to try and improve services for people by making the voice of users heard. And then the third thing is actually providing training and consultancy to organisations to improve the way that they interact with mental health. So that's how we sort of meet our objectives. The different types of services that we offer are advocacy and advice, then wellbeing services, and then therapy. And whilst we don't have services that are specifically targeted at those below the ages of 18, we do have quite a few people increasingly coming to us that are below the ages of 25, so which we would still categorise as being young people. And prior to me working at Mind, I worked for a place called the Brandon Centre in Camden, which is a children and young persons mental health and sexual health organisation. So that's me, that's my organisation. I'll stop waffling on.
That's great, thank you, Alex. We'll make sure we put some information about Mind in the chat box as well, thank you. And moving on to Carla Brain, please, from the Enfield Carers Centre, who's the Young Carers Manager. Thank you, Carla.
Good morning, everyone. Enfield Carers Centre is a local charity that offers support and advice for unpaid carers living in the London Borough of Enfield. And at Enfield Carers Centre, we have a Young Carers project called EPIC, which stands for Enfield Young People in Caring. We support children who are aged between 5 and 18 who have a caring role, and we can offer respite activities, personal support, help with schoolwork, and quite a different amount of support. We offer quite a lot of support, really, to people that have a caring role aged between 5 and 18.
That's great. Thank you so much, Carla. And I'd like to introduce Nina Ubani from Wellbeing Connect Services, who's the Senior Advocate. Thank you, Nina.
Yeah, thank you for having me. My name is Nina Ubani, as I said. I'm the Senior Advocate at Wellbeing Connect Services, and I'm actually also managing quite a lot of the projects that we're working on. Wellbeing Connect Services is the leading Black and ethnic minority mental health charity in North London, with excellent track record of providing valuable and life-changing services to families in Enfield for the past 23 years. We offer a one-stop shop care approach to families experiencing mental health and domestic violence issues through a variety of services, such as independent advocacy, specialist advocacy support, self-care, group support, mentoring and training. And obviously also during this COVID, we've started doing like a hot soup kitchen slash a place where people can just pop up for a chat. So we've been running that on a weekly basis. And we've managed in this period to be able to feed over 3,000 families. So that's us in a nutshell.
That's absolutely fantastic. Thank you, Nina. That's great. And I'd like to move on to Dr. Emma Gore-Langton, who's a Senior Specialist Educational Psychologist for Social, Emotional and Mental Health. Thank you, Dr. Emma.
Thank you, Sue Jane. Hi, everybody. I'm from the Educational Psychology Service. So our usual work is supporting the learning and also the well-being of children in Enfield schools. So mainly helping the adults around them to understand their needs so they can meet them better. We do this through the education, health and care needs assessment process for some children, but most of our schools also buy us in so we can support children in a flexible way. We also have educational psychologists working in lots of other partner services across Enfield, such as the mental health support teams and the behaviour support service. And as part of the educational psychology service, we have teams delivering more direct therapeutic work, including our school's emotional wellbeing service and our children's wellbeing practitioners that Zoe will talk about in a minute. During the pandemic, we focused on offering a trauma-informed community response, so offering more direct access for parents and carers via our telephone support line, which was a community support line, and workshops and groups for parents and carers, which anybody could directly book onto. And we also focused on making sure that we supported school staff well, because we know that often school staff are the people then supporting you. So we had a telephone support line for school staff. We offered individual support for head teachers and for governors who were kind of bearing the brunt of everything coming from the Department for Education. And we had a really extensive professional learning programme on mental health and wellbeing for school staff so that they felt more confident to support children. Thank you, Sue Jane.
That's lovely. Thank you, Dr. Emma. And I'd like to introduce Zoe Ebanks, who is the Children's Wellbeing Practitioner with the Educational Psychology Service.
Sorry, broke up a little bit there. Hello, everybody. Yes, I am a Children's Wellbeing Practitioner, so CWP, in Enfield's Educational Psychology Service. I work with young people, children and their families, delivering guided self-help CBT, so cognitive behavioural therapy. I work with adolescents who are struggling with low mood or anxiety, and then parents of children with challenging behaviour or anxiety as well. For both of them, I would work one-to-one for around an hour a week for up to 8 weeks, and delivering that CBT. And I also do some group work, as Emma was saying earlier, and some live workshops online too.
That's fantastic. Thank you so much. So as you can see, we've got a really experienced panel with us today. So I really appreciate you all joining us. Thank you so much. And without further ado, I'd like to go into the questions. So let's start with the first one. This is on behalf of Tracy from Enfield Disability Association. The question is, what support is being offered to young people and children to help them with their mental health issues, especially during the pandemic? And can they self-refer, or do they have to be referred over? Perhaps we'll start with Nick from CAMHS for that first question, please.
Okay, thanks to you, Jane. I mean, in terms of the range of support, I think Michael touched on this a little bit in the introduction, but we have a range of different specialist teams in our service that cater for different types and levels of need. So we have a team that covers the kind of whole range of common mental health problems in children and young people. We have a schools-based team, which is the mental health support team. We also have a team which offers crisis support for teenagers, a team for children with learning disabilities, a team for children who are in the care system, and also we have input to other services in the borough, such as the youth offending team as well. So we're kind of catering for a whole a range of needs really in our service. I think some of the main types of support we offer are that our teams are largely staffed by psychological therapists. That includes clinical psychologists like me, psychotherapists, family therapists. We also have nurses and psychiatrists who provide support in our services as well. And there's a little bit more information about the range of support we provide in the summary that I sent to you that you mentioned, which I think you'll post a link to or publish on the website, perhaps. In terms of support during the pandemic, we've worked really hard as a service ourselves and also with our other kind of partners in the borough to kind of plan and coordinate services through all the challenges of the last year, and to try and keep kind of continuing support available when and where it's needed. So we've kept our service open throughout the pandemic, and our clinic has been staffed, but we've been delivering the service in quite a different way over the last year. So we've had a staff presence at our sites. We've continued doing some face-to-face work over the past year, but we've had to kind of prioritise that for at most times for the more urgent and essential work. But we've now, over the course of the last year, and actually quite early in the pandemic, we moved to a much more blended offer of support. So offering phone support, we've now got a well-established video therapy platform as well, which lots of people are using and taking advantage of. So there's kind of quite a lot of changes in our service to make sure that we're continuing to provide support through the pandemic. There's also been a lot of attention on the crisis care. So we've done a lot of work with other partners across the wider region of North Central London. So our colleagues in Barnet and Haringey and Camden and Islington, really to coordinate the support that's available for children and young people who present in crisis through the hospitals and accident and emergency departments, really to make sure that those arrangements have been strong and responsive, especially with all the changes that have happened during the pandemic in terms of the pressures on those acute hospitals. And then lastly, just in terms of referrals, I think that was the other bit of the question. So currently, our referrals, we take referrals from the sort of wide range of professional sources. So from general practice, through schools, social care, other NHS services, and other professional agencies and voluntary sector services in the borough.
That's lovely, thank you, Nick. And it kind of leads on to the next one. The next questions is about how can you get an urgent CAMHS mental health assessment when there is a waiting list? And what other help can parents access in the meantime? So I think this is where perhaps the other community groups and organisations might be able to step in. But regards to the actual mental health assessment, an urgent one, is there a waiting list, and how do you access that?
So in terms of urgent support, so all our teams will prioritise cases of higher urgency, and where that's needed. So in terms of our service, that's really our main prioritisation is based on risk. So if there are really serious urgent concerns about a young person being at risk, that's the kind of primary prioritisation for us. There are different avenues of support in terms of urgent support. So through the last year, through the pandemic, we've created a duty line, which professionals can contact the service if they have urgent crisis concerns about a young person, so that we can provide some advice and to make sure that young person gets the right support. There is also now a 24/7 crisis line for children, young people and families to call. I can just post the number for that in the chat in a moment. And we've also set up a system for, so when necessary, that if young people present urgently to accident and emergency departments, and that a kind of diversion from hospital assessments to community crisis hubs as well, so that we can provide that urgent support for people.
Thank you, Nick. And perhaps I'd like to go to Emma, as Emma Gore-Langton, please. Perhaps you'd like to add to that.
Thanks, Jane, and thank you, Nick. It's so good to hear what's available. I guess I just wanted to put that in a broader context a little bit, in that urgent specialist help is absolutely what some of our children and young people need, but by no means all of them. And we know kind of from evidence-based models of trauma recovery that it's important that we don't rush in universally assuming that, and I'm not saying you said this, Nick, at all, that everybody needs lots of help. So we know certainly that coming out of the pandemic, everyone needs good relationships. Everyone needs good transition support. Our children need flexibility to readjust. They need more opportunities to do things they enjoy. And of course, these are things that we can all make accessible to children and young people. We can do these things as parents, and crucially, our schools are doing a lot of this good work. So from the educational psychology's perspective, a lot of our work is with schools so that they feel confident to support the well-being of children and their broader recovery. I know that one of the schools for whom I'm the link EP, in the week of the 8th of March, rather than rushing to catch up with learning, they had a lovely school-wide sewing project so that children had time to reconnect with their teachers, time to reconnect with their friends and do something they enjoyed. So, and some of our families will need, or schools will need, a little bit of consultation, but perhaps not full-on mental health treatment. And for those children, the consultations to schools or the telephone consultations, which are directly available to parents, are important to talk things through and give you a steer about how you can support your young people. Thank you.
Thank you, Emma. Would any other members of the panel want to chip in as well to sort of explain how they could help people in that interim as well? Okay.
I guess, oh, sorry.
Yeah, no, carry on, please carry on.
Sorry, Sue, I was just going to say that I guess kind of what Emma was saying as well, sometimes if a young person or family has a mild to moderate needs for anxiety or low mood, then definitely see the CWP intervention could be useful as well. and which they would need to ask their school to refer to us, and that would be then and then they could get seen by one of the team.
Great, thank you. And there was also a question regards, I know that Nick, you mentioned that there was a learning disability team that within your service, and there was a question around how do you help children's mental health and wellbeing if they have special needs and are not able to articulate themselves very well or at all? Perhaps you can explain how that works within your team, please.
So I was just going to say some, because it's quite convenient, because I also oversee the children's therapy services within Enfield that sits within Enfield and Haringey. So there's a bit of a coterminous arrangement here. So perhaps I quite welcome this question. So there's an element about how, as mental health colleagues and practitioners working alongside allied health professionals, so that's speech and language therapists, physiotherapists, occupational therapists, and how we support those families, particularly where there's children that are non-verbal. So we know that within the borough there's quite a lot of work and support around Talking Maps, which is a tool to support families and children where we have to look at other ways of communication, and that's something that's very rich within the services that we're using. But one of the challenges, and I think Nick touched on it earlier on, is about the fact that within therapy services they have tried to sustain still having face-to-face contact with families during the pandemic, and that's been very helpful. And in those situations where they've had to move toward a virtual platform, they've been able to adapt their methods of working and their communication styles to support parents, and enabling them to have some of the tools to support working with children that have non-verbal, that present with non-verbal issues. I guess how that works within our mental health element is that we also are working alongside in MDT, so working in some of the schools within Enfield, the special schools, and working alongside our psychological therapists as well as the practitioners who are coming from an allied health professional background to support families. And a number of those cases are actually open across the two teams, and so it's how we support the families in that sense as well. So that's pretty important for us, that we've recognised that there's a gap in the service and how we try and support and mitigate some of those families not being able to have access because of the presenting issues for their children.
That's lovely, thank you, Clive. And Nina, you'd like to add something, please?
Right. What I wanted to say was, like I had my hand up from earlier, was the support that we provide from Wellbeing Connect services to young people in the community. Like over this period, we've worked with, I think 10 schools where we're actually being referred children from the schools that thought that the children were struggling. So, and we've carried on doing that. We provide like therapy and counseling. So if there are like any young people that you're working with who actually you feel might benefit, to let us know, and we'll be able to do something about that.
Thank you very much, Nina. That's great. Thank you. What's the youngest age a child can be referred to get mental health support? That's open to the panel.
Hi, Michael here. So just to say, for Enfield CAMHS, we have no bottom age. So basically, we're 0 to 18 service. And just a quick glance, currently our youngest child is 2 years old. We're providing support. Often for the younger children, the supports with the families, but yeah, there's no bottom age basically. And we've got a specialist team that provides CAMHS support for under 5s, but then we've also linking with the child development team under the paediatricians, and there's clinical psychologists in that team as well.
That's lovely, thank you very much. And I've got a kind of a multi-pronged question for the next one. It's about, are parent requests for diagnosis increasing, and what are the most common problems young people are experiencing with their mental health? And are there signs to look out for? It's a kind of a multi-pronged approach really, this, but I think it's what a lot of parents are concerned about. They don't know what they're looking for. They know that their child's perhaps distressed or is gone quiet or is angry or whatever the actual feelings and emotions and behaviour they're experiencing, but it's what are they looking out for, and are there more requests for diagnosis now? Perhaps we could start with Nick.
Hi, I'd say in terms of requests for diagnosis, I think overall, I think they are increasing in some areas, but not all actually. So we do have a high and increasing number of requests, particularly around issues such as the diagnosis of autistic spectrum conditions, and ADHD, which is attention deficit hyperactivity disorder. And that's quite a pressure point on our service in terms of quite a high number of requests for diagnosis and meeting that demand. I suppose I think one of the things I would add to the issue about diagnosis and this doesn't just apply for CAMHS, so I think in CAMHS, but also and in schools and in the other agencies around that are working with children and young people and children and young people's mental health, and also in kind of education and learning, is that our perspective is very much focused on being a needs-led service and not necessarily a diagnosis-led service, which means that I suppose getting access to the kind of resources and the support that you need really should be, we see it as being related to an individual's needs and not necessarily the label or the difficulties that are described by diagnosis. And I suppose how we often work with children, young people and families is that, sometimes having a diagnosis can be helpful. It can sort of give you a means of kind of understanding and sort of feeling that you have some sort of explanation for the problem. But I think also for us, there's something which is a bit more broader than diagnosis, which is more about an explanation of kind of why the problems or the difficulties occur. What are some of the things that maybe keeps the problem going, and what are some of the things that can change that and can help change the problem and help people change their goals. So so I think when we're working with young people and families, we're also trying to keep that perspective in mind, which is, I think, a little bit broader than just the issue of a diagnosis and a kind of description or a name for the problem.
And perhaps the other members of the panel might like to have something to say about it as well, because obviously they may have found that their services have increased or requests for services have increased, and perhaps in what capacity would be useful to hear actually. Would anyone else like to add to that? Alex from Mind, please.
Hi, yeah, this is sort of, I think it's an area that comes up a lot in mental health generally, actually, which is where often the sort of, whether it's a young person or an adult, you could be a carer of an adult or you could be the parent of a young person. Often what you're looking for is a diagnosis, and it's completely understandable because in some ways that is sort of reassuring because it helps you sort of define and contain what's going on. But actually from that point onwards, it's really about what help and support the person is getting. And even though with diagnosis, you might have a list of very common signs and symptoms and so on, it will really vary from one person to another, as does like how that individual can recover, can progress, and so on. So I always look at it as sort of an initial kind of starting point in trying to understand what's going on. The other thing that to be aware of is that if you do get a diagnosis for a young person that you're looking after as well, is that to my mind, there is a danger that we can over pathologize. We can then think of that person and see everything that they're doing through that lens of diagnosis, which in the end, to me, I don't think is particularly helpful. I guess the other sort of thing that I know that CAMHS does, but it's also a point I just want to make, is that often when you have the young person, firstly, one of the easiest ways to see if there is something going on in terms of the young person's mental health is a change in behaviour. Like it's just a change of one kind or another. That could mean that something's up. But when it happens, it's sometimes the young person is almost symptomatic of a wider dynamic around them outside of the family or around them in the family as well. So often it's thinking about it as a system as a whole, which is why the role of parents, the role of people around the young person in the middle is really important. And sometimes actually, I mean, it might be a bit of a shock to parents in this situation. One of the things that psychologists often do is the first bit of work they'll do is not necessarily directly with the young person, it might well be with the parents. So anyway, that's my threepenny's worth, sort of a bit of a wide-ranging monologue, but there you go.
Now that's useful, because different perspectives really helpful actually, because, you know, it's quite hard for a parent because they know their child really well, but sometimes it's explaining it to others how there's been a difference or change in that child, and it may just be part of growing up, it may be something else. So it's quite hard as a parent because you're an expert on your child, but you're not an expert on the system or how things work. So I think that's where there can be sort of disparities sometimes.
Well, I just want to go. I would go further than that. I think one of the hardest things from a parent is that where's the manual? You know, there isn't one. We're expected to get this stuff right, you know, if you want to drive a car, you've got to train, right? You know, if you want to do that, you've got to. It's taken as read for all of those things. You've trained, studied this and that. Being a parent, no. You're left up to your own devices. So I think it's super tough for parents, really hard in this situation, actually. So yeah, support for parents, the more of it we can get, the better.
Exactly. And what about the other organisations? Have you got any ideas or thoughts on any signs to look out for or support that you might be able to offer to parents today? Okay, we'll move on to the next. Oh yeah, we've got Tristan from Kooth, and then we're going to have Nina afterwards. Thank you. Tristan, would you like to say something?
So I think on our service, I know that we have seen a very big kind of increase in body image talk for both men and women, and kind of eating disorders, which has been probably consistent, which is what everyone is finding. And some of the things that we tell kind of parents and carers to look out for is, you know, their young person maybe is talking more negatively than they were. They're more hesitant to engage with their peers or their family and friends, and that they're being overly obsessed with kind of this healthy eating kind of thing. This over health culture has been a really big kind of thing in pandemic, and they've been talking about the pandemic body. So those are all things to kind of look out for, is if your young person is just getting really, really pre-obsessed kind of with the healthy living kind of culture.
That's great. Thank you, Tristan. And Nina, you'd like to add something?
Yeah, I just wanted to say, like, over this period, obviously, we've had like an increased amount of young people who are actually requiring services or requiring support. And one of the reasons being the fact that most families usually did not get to spend as much time as they're spending now. And most people weren't getting along. But, you know, with going to school, meeting up with your friends and just doing activities could minimize that. So the full impact was felt during the lockdown, and you know, an increase of domestic violence, not just between partners or parents, but also from parents to children and children to parents as well. And I would also say, in addition to the last speaker, like she said most of the things I wanted to say about science to sport. But another thing is, when a child starts becoming more withdrawn, it will be a sign that there's really something up.
Thank you, Neil. That's really helpful. So we've got a couple of questions that are quite specific. In what ways can private practice therapists trained to work with children get involved with local initiatives? Anyone able to answer that one at all?
I'll give it a go, Sue, because when I saw this question, I got quite excited actually from BH point of view. So it was quite, I thought it was a very helpful question. So I was thinking in a broader context that not only we on the panel, but also families and anybody listening would know the challenges that are facing the NHS in relation to the whole sheer refocus that lots of services had to do during the pandemic and continue to do, and what the implications have been in relation to cancer, diabetes, and individuals getting access to the system. So we're having to think much more locally about how we can continue delivering the service, but also mindful that actually there are a number of families and children who would have not been able to access the resources in a timely way. So we're having to think about how do we bring in additional support. So when I was reading this question, I was thinking, what are the local initiatives? It's about whether somebody has the skills and expertise in terms of wanting to support the additional workforce, being able to offer sessional input into the service. So from that point of view, I'm sure there'll be lots of opportunities depending on the skill sets that people that could potentially be used in different ranges of services, because we're having to think about expanding the workforce. And obviously we know within speaking specifically about the NHS that actually there is a shortage of a whole plethora of different disciplines, but it's also about how we can try and start to work on a recovery approach within the service. So it's thinking about those skills that individual therapists may have and how they could be able to access, join the bank of local NHS organisations, be able to offer sessional work, maybe one of those initiatives, and it's about knowing what those links are. So if there's anybody that's listening, I'm more than happy to provide the link of our temporary staffing details within the NHS that people can actually sign up in terms of what skills they have and how they could be used locally. So that's sort of thinking from a slightly selfish point of view, but in terms of for us within CAMHS, that we'd welcome those opportunities for those skills that may be around within our local community as well.
That's fantastic. And I think that's about having that holistic approach, isn't it? Sort of, I know that here we've got lots of organisations that are doing fantastic work. So it's getting that approach where you can actually go to different people for different things and use that skill base to actually get the help and support that people need ultimately, because that's all the parents really want, is to get that help and support. So the next question is, how does health and social care relate to psychology? You'd like to answer that one?
I'll have a go. When I saw that question, because I wasn't sure if it was talking about as kind of subject areas, or also because I was also thinking sort of with my professional hat on about how our agencies work together. So maybe I'll say a bit about both, because I suppose in terms of health, social care services, I'm a clinical psychologist. We have Emma, who's an educational psychologist, on the panel as well. I suppose we are kind of, I think our relationships and our working together is something that we think is really vital and really important. And I think earlier, Alex sort of touched on a bit about how, there's all these kind of systems and networks around children and young people. So we think it's really important that our agencies and our organisations and our services work together, both, I think with individual children and families that we're working with, but also it's something that we very much try to do in terms of trying to plan and improve services in the borough as well. I think as subjects, I like the subject of psychology. I think for me, psychology kind of spans both those areas of kind of health and kind of social care and social factors as well, which for me is why it's such an interesting subject and partly what sort of drew me to psychology. I suppose one of the areas that we think about in psychology and mental health is what we call a biopsychosocial model. So it's about spanning the kind of biology of kind of human behavior, sort of how our minds work, the kind of physiology of our brains and bodies, the psychological, the kind of social aspects of human behavior as well. So how our minds, how our moods, how our thoughts, how our bodies and behavior kind of interact, but also in a social context and in an environmental context as well. So all those things have an influence on each other. And so as a subject, I think psychology is kind of very broad and spans those different areas, really.
Thank you, Nick. We're going to go on to anxiety now, because that's something that's come across very strong as on the questions that we've had. And perhaps Zoe, you can answer this one. What advice can you offer young people and to their parents and guardians about feeling anxious? I think because there's been an awful lot of fear around COVID, around change, around all the things that have been happening during the last year and what can happen in the future as well. So perhaps Zoe, you could perhaps answer that one and see what your thoughts are on that, please.
Yeah, definitely. I think the one thing that I would say about anxiety is that avoidance is not helpful. So whatever it is that you're worrying about, whatever it is that you're anxious about, avoiding it may be helpful in the short term. Of course, you're not going to get those anxious feelings of, the heart rate increases and the sweatiness and the nausea, but it won't help your anxiety in the long run by avoiding it. So what I would suggest is to gradually try to face that fear or whatever it is that's making you worry in a step-by-step plan. So starting with something that you feel really comfortable with already. So if you're scared about, for example, if a child is scared about putting their hand up in class, first start doing it in a class that they know that they're really comfortable in, or when they're sitting next to a friend, doing it as easy as they can first, and then gradually building it up until they can do something that's a little bit more anxiety provoking. Also, if it's not something that they're necessarily worried about something happening, or if they're not avoiding something in particular, and instead it's something that they kind of get those anxious thoughts and this kind of uncontrollable thoughts that they get, one thing I would suggest is thought acceptance. So that's the idea of kind of distancing yourself from your thoughts. So instead of thinking, I'm a failure, and having that thought and believing that thought, train yourself to think, I'm having a thought that I'm a failure. So kind of putting yourself a little gap between who you are and what you're doing, which is having a thought. And that can kind of allow you to accept your thoughts for what they are, which are thoughts, and stops you from believing in those thoughts and kind of going on to, really ruminating and believing in those negative thoughts that we do get naturally. Yeah.
It's almost unlabeling yourself from what your thoughts are telling you, isn't it? Almost.
Yeah, definitely. Yeah.
and Alex, you'd like to add to that?
Yeah, I mean, just I was listening to what Zoe was just saying there, and I think a lot of what you were saying, there are things that are really core and fundamental principles of mindfulness, which does have implications for by younger people. So actually, some people say that sort of depression is being stuck in the past, anxiety is being stuck in the future, and mindfulness is a really good way of tuning in to the present, understanding the relationship between yourself, presence, and thoughts, and how those things are different actually in the way that you're describing, and just acknowledging that can be a really big breakthrough. So yes, mindfulness is a great thing for people of all ages to kind of try and master some of that stuff or get to
That's right. Sorry,
Emma? The other thing that we would add to Zoe's excellent advice is that we have a responsibility as the adults to look at the situation that the child is anxious about or might be driven to avoid, and to check. Facing your fears is a really good advice, as long as there is no like, if, for example, if you're scared of dogs and you face your fears, you'll come to realize that actually most dogs are relatively harmless. If you're scared of school, and actually when we look into it, you are being chronically bullied at school, us as adults kind of pushing children into facing their fears without dealing with the difficult situation or the unbearable situation, which is the bullying at school. So I hope this is making sense. Essentially, we have a duty to make sure that we are doing everything we can to make children's environments better, and to make sure that when they do face their fears, they find that it's okay. Because if we keep pushing them into situations that aren't okay, we're re-traumatizing children in a way.
That's great. Thank you, Emma. I've got a parent here, Nora, who'd like to actually ask a question herself. Nora, would you like to ask a question?
Hi. I don't remember how I worded it when I was signing up, but just wondering for some advice about how to help the child dealing with anxiety. My daughter started biting her nails a lot, and I mean a lot, to the point that they're bleeding now. And to me, that's like, obviously that's some anxiety, but children don't normally talk to their parents. So if I ask her what's wrong, she'll say nothing. So is there anything you can give an advice on how to deal with that?
Thank you, Nora. Open to the panel. Anybody who'd like to answer that?
I mean, I can start. I feel like I completely understand what you mean, Nora. I mean, if she's biting down to the point that it's bleeding, and of course it might get painful to her, it might get infected. Of course, that's definitely something that you have to keep an eye on. What I could suggest is perhaps making a reward chart for her. So if you do want her to stop, kind of pointing out to her, look, if you can grow your nails to, I don't know, wherever on her nail bed, then she will get a reward for that. It is important to think about that everyone has the little things that they do to kind of cope with their anxiety, and not all of those things are helpful. So what you would need to do is to think about what you would like her to do instead, and try and encouraging her, and also noticing that that is what she is doing, and kind of seeing the conversation about, is she anxious? Does she have those worries? I know you said that you asked her what was wrong. She said nothing. Perhaps making that conversation a bit more rewarding for her as well, and ask questions and kind of make suggestions to her, like, is it because of this? Is it because of that? I wonder if it's because of this, and let her correct you if she wants to. And also be patient with her. Sometimes they just don't want to talk about it now, and ensure that she has got someone else to talk to. Maybe it might be a sibling or a friend. Like if she doesn't want to speak to you at this point, then she can at least speak to somebody. Yeah.
Thank you. And Nina, you'd like to add to that?
Right, she just said everything that I really wanted to say. But just one thing I wanted to say is, not just coming from obviously we don't know it all, and working with children, and also being a mother myself. Sometimes when we are anxiously speaking to young people, it tends to make them close up. But if, like, because obviously you're afraid and you're worried, I know it's very easy for us to go like, oh, what's wrong? Instead of like, just, kind of like watch our body language when we're interacting with our young people. And then also when they do tell us things, try not to act worried or scared or shocked or anything, and just be like, okay, and then just gradually let them come to you and open up and stuff. But also, if there's an older sibling or somebody who she trusts, kind of like try and see if you can get them to open up to that person. Yeah.
That's great. It sounds like actually just encouraging communication is really important, because obviously once that child starts to open up and speak, then you can actually help them effectively, where the route is, or you can at least stop that journey, if you like. So, because there was another question around potentially obsessive compulsive disorder, where somebody, or OCD as it's known, where somebody's been washing their hands a lot because of the pandemic and the fear around catching the virus. So it kind of, it almost sounds a little bit like the nail biting. It's an anxiety thing. But is there anything you can add to that around? Obviously, we were told to wash our hands, so it's not an instruction from the government. So how best can we manage that with our child?
I'm happy to start off on that one, and also just extending, because on the advice to the other speakers in the previous question, because I think that's good advice. And I suppose that is, for me, there is something really important about building on that communication, as Nina was saying. So I think there's something about, it's about kind of creating a space to talk, but without necessarily there being an expectation or an obligation for your child to talk, really. And I think it's, and so just kind of creating sort of opportunities where, which might just be sort of doing certain kinds of activities together and kind of being really curious and listening, so that, if the conversation develops and your child does feel more able to tell you something, that's a kind of bonus, rather, because I think sometimes, I think when we go in sort of really, because it's really hard when you're feeling worried about your child, kind of really wanting to get to the answer, that can sort of create a bit more tension, and sometimes that can kind of get in the way of communication. I think specifically the issue around kind of health, anxieties about health and hands washing and so on, I think, as you said, Sue Jane, I think heightened anxiety about germs, is much more normal for kind of all of us at this time. And so, I think it's important to kind of hold that in mind, and that, because, I'm certainly, more conscious of that, kind of hand hygiene and so on. And I know lots of people that I know, probably everyone I know is really. And, I think, like has been touched on before, about kind of recognizing the signs that it's, I think it's really important that you kind of recognize these kind of changes and differences in your child's behavior, and you pick up on them. I think, kind of like we said, I think there's something about just sensitively kind of exploring it. So kind of creating that space to talk, to try and be curious, to listen, and to really try and understand what your child's worry is, what, kind of what their thinking is, what's the thing that's worrying them. And I suppose there's something about, particularly with the pandemic, about trying to develop a more kind of balanced view of the dangers, actually. And that can help kind of build a sort of greater sense of kind of control, and also a sense of hope that things are going to improve and get better. So that might include, kind of modeling kind of what's kind of proportionate kind of hand hygiene and self-care around infection. I think paying attention to the sort of sources of information that you're paying attention to, or that your child is following about COVID. So kind of trying to support them, it's that thing about, I think earlier in the pandemic, we were kind of bombarded about information, and so trying to sort of limit that, and kind of keep to reliable sort of child-friendly resources. So things like, kind of news rounds, the Young Minds website, stuff like that is important.
Yeah, that's great. Thank you, Nick. That's really, really good. So There was a question around child bereavement support, and Nick was very kind to send details of Grief Encounter, which is an organisation that gives information about bereavement. So we'll put that in the link there for everybody. But is anything anyone wants to add to that from the panel at all? No. Okay, we'll go on to the next one. I think we've mentioned a lot about confidence and opening up, but there's one that's about negativity about people's prospects, a young person's prospects and life ahead. They're much more nervous and worried than they used to be before the pandemic, and can get angry a lot and stay in their room a lot. And it's like, is that normal, brackets end of brackets, or is it something I should try and get to talk up about? Who'd like to discuss that one? Zoe, thank you.
I think the low mood, or the irritability, or wanting to be alone a lot of the time for young people, it's definitely something that does happen to a lot of teenagers in adolescence. But it's definitely something that I can understand the parents need to keep an eye on to make sure they're not actually becoming quite low in mood. It's kind of what we were talking about a little bit earlier, that you can encourage the conversation, and you can make talking about your feelings and talking about how your emotions part of the family routine. And it's not something that you're just directly asking that young person about. You're not putting them on the spotlight. This is something that we all do around the breakfast table, around dinner. We all talk about our feelings, and you as the parent also talking about age appropriate and child friendly things that they can know about what you're thinking about, what you're feeling about too. I think as well, it's important to kind of encourage, it's called the ACEs. So it's the things that make life meaningful for everybody. So children, young people, and other adults as well. So it's about gaining a sense of achievement in things. So finding things that they, are good at, things that they feel connected to others, and things that they get an enjoyment out of. And then as a parent, really encouraging those activities throughout their life, and making sure that you're encouraging them to do those things can really help with their low mood as well, if they do have low mood too.
Thank you, Zoe, that's great. And there's a question about parents splitting up. Is there help for young people with these emotions? Because obviously they can't sometimes speak to their parents about it, or there's that sort of trying to please everybody, not saying really what they think. And I think that's quite a tough one. It's like, how do you get help, maybe independent help for that young person? Nina, did you want to mention something about that?
I had my hand up from the last question. So, okay, so continuing on from what Zoe said, we actually obviously understand the importance of young people being able to obviously express themselves and find like a self-worth thing. So we're actually currently making a movie with young people about the pandemic, in the pandemic. So we've been, this is like our 6th week. So we've had like all different filmmakers and stuff like that come and speak to them about how to make movies and stuff. So the point of this project is not just the movie, it's to get young people talking about their feelings and what they're going through. And through that, we've been able to kind of like piece together like a story, which I'm sure that a lot of people might be interested to hear in the long run. So it's about a young person and the process they've gone through, about feeling of worthlessness, about not knowing the direction they're going in life. And like with the pandemic, it all felt like this was it. So a lot of young people lost hope, and this was the first time they were ever in their life faced with any form of challenge, because they're just used to just being looked after and stuff like that. Maybe family members fell sick and they had to kind of like stand up a lot more. So there's just so many things that are going on with young people that has affected and impacted their self-belief, self-worth, and confidence. And yeah, we're trying to bring all those issues out so that young people can actually use their own voices to highlight what they're feeling, and also make them feel like they're doing something and they're achieving something in the end of it.
Thank you, Nina. There was actually a programme, wasn't there, with Ronan Kemp about his experience when his his friend actually took his own life, and it's very unexpectedly. We've got a link for that because it's about, again, it's about getting people to talk. Because his friend obviously made out as everything was fine, there was no problems, and no one had any clues that you know, he was obviously very unhappy, and as a result, he lost someone very dear. So it's about getting, especially young men, to talk, because I think that that's an issue that can be quite difficult. So we're going to put the link in there. So if you want to watch it again on BBC iPlayer, you can do. But it might be quite interesting to sort of find out a little bit more about that as well. And it's about encouraging people to talk. And when you say, how are you? You don't say it once, you say it twice. And you say, well, really, how are you? Because we tend to say, oh, we're fine. It's an automatic response. We're probably not. And it's okay not to be okay. That's another message from that particular film. So with regards to parents splitting up, is there any particular support or help? Or is that just really about getting young people to talk and to perhaps speak to other friends about it, and perhaps other relatives maybe? Any thoughts or suggestions from the panel on that one?
So, I mean, other people on the panel might be able to correct me, because I'm not sure of any specific support in terms of a service in the borough which focuses on that issue. But I know there is some really good kind of supportive information out there to kind of give advice to parents and also to children and young people. So for example, I know there's some good information on that subject, for example, on the Young Minds website, which has just been posted in the chat as well. That's fantastic. And so things like, and certainly, you know, I guess with some of the families that we work with in CAMHS that have gone through kind of separation and divorce, you know, I think some of the things that we would sort of highlight as very important are that, you know, it's kind of, I think trying to, although it's, you know, it can be very difficult, but sort of trying to work to kind of make sure that children can try and have as good relationships as possible, and kind of easy contact with both parents when that's possible. You know, kind of trying to shield children from kind of overt conflict between parents, for example. As we've said before, really listening to your child's concerns, kind of accepting and understanding their emotions and so on, and trying to kind of maintain, you know, quite predictable and reliable arrangements, so that there's a bit, you know, I think that can help with, so that kind of attention to sort of supportive, kind of reliable, containing arrangements for children is important.
Thank you. And Alex, you wanted to add to that, please?
Yeah, it just builds, I agree with all of that, but it just builds on a point I made before as well, which is don't think you just have to sort of get advice from your mates or your family and make it up as you go along. There's a lot of information out there. There's a lot of people that have done research into this. There's evidence behind it. There's great books out there. There's fantastic services and so on. My advice is that I would reach out and get some help from someone, begin to read, you know, as soon as possible, because it's not easy to deal with in any dimension, and when you add kids into it, it becomes even more difficult. But there's a lot of really great resources out there, a lot of really good stuff out there. So get help, get assistance. Don't feel that you have to. Same with all of this. Don't feel that you have to do it all yourself and do it alone. You don't. You really, really don't.
Thanks for those great links as well. That's fantastic in the chat box. That's great. Thank you. And a question about youth clubs. Do you think there are enough in the area for young people to go to and to actually enjoy? Anyone like to comment on that at all? Okay, well, ultimately, I suppose if there's resources, you know, in the borough, they'll be finite, but at the end of the day, I think, you know, as many outwardly ongoing resources that you can access is always great. Emma, did you want to say something?
Yes, I was just going to say that it's not for me to say whether there are enough, and I haven't personally used them, but I just wanted to draw everyone's attention to Youth Enfield, Inspiring Young Enfield, and also the Summer University. And these have been available in some form during the pandemic, and as the world opens up again, are able to return to their former delivery models of in-person support.
Thank you very much. And there's a question around drinking in their young people. Has any other parents seen an increase in drinking? And if so, what resources can the panel suggest? We have got a link for CAMHS UK that we can put into the chat box.
Yes, the CAMHS.
Anybody want to address that question?
I wonder about the ways in which this links into our discussion about
Emma,
how young people...
on it. Emma?
Yeah. Is that okay? I don't know if you can hear me. Okay, I was just wondering about the ways in which, for example, drinking might link into some of the ways that we've talked about how children and young people might have been feeling over the last year in terms of having their independence completely cut off, having their futures very uncertain, and frankly, there being very, very little that they can do that is enjoyable or meaningful to them within the confines of their bedrooms or their home. So I guess I'm wondering, as more opportunities and more activities are available to young people again, how we might encourage young people to find other things that they enjoy, to make plans to go out and do things, and I guess keep a kind of a watchful approach to whether those drinking behaviours decrease as the young person's life becomes bigger and fuller.
That's great, and thank you, Alex, for the extra link in there for Drink Aware as well. That's really useful. Next one is, if a child is having concerns about their sexuality, what help and support is there? And Nick kindly gave us links to Young, Stonewall and Proud Enfield. Does anybody want to actually comment on that, please? And there's a lot of help and support out there, and there are local groups as well. So if we put those links in there, then parents can actually have a look at those. That'd be great. And there's still a lot of embarrassment about mental health. Can the school help? And I think that's been touched on earlier, where I think schools have said what they can do and how they can link into CAMHS and other services. But is there anything around the embarrassment side of things that you could actually say how to deal with that or how to manage that at all? Nina, would you like to say something?
Yeah, I feel like most of the time it's the keeping quiet and not talking about it that actually makes people kind of feel stigmatized, especially within the Black and ethnic community. Obviously, there's a lot of stigma when it comes to mental health. Because when you say someone has mental health issues, immediately they're thinking of, psychosis and, so many like the extreme cases, and there's not like much awareness and there's not much acceptance. Like for me personally, I'm someone who have actually experienced mental health issues and have now started working in mental health environment. And usually when I do talk to people in my community, I use myself as an example, because when you say you've got mental health issues, immediately they're looking at someone who is on chem, someone who is looking, a certain way. But when you say, okay, this is me and this is what I've gone through, I find that more people actually come forward to say, you know what, I'm actually experiencing this as well. So I think talking is very important. And one of the ways that we've actually worked with schools in getting more young people talking about their mental health and things is through debates, which we've organized like a few years even before the lockdown. And we've actually got we're planning in going into schools in Enfield coming up from next. We've got some schools that have actually responded that they wanted to participate. So we'll have young people talking about mental health, debating, looking at ways to support each other and things like that. So I think when we can actually work with schools, because schools are kind of like, not saying that you can't work with other organizations, because usually when you have to now refer someone somewhere else other than school, it's a thing where, oh, there's something wrong with me. But if it's within school, which is where they get all the information they need, it kind of like normalizes it. So one of the things, like I said, we're doing is like debates, and we are really big on kind of like indirect talking, because when you say mental health, people also get scared. But when you say things like, obviously, are you feeling low? Are you feeling anxious? Those things we understand are mental health issues. So we kind of like break it down to maybe more palatable terms to encourage people to talk more about it.
Absolutely, thank you, Nina. And Emma, you wanted to add to that, please?
I completely agree, Nina. And we had a very interesting experience when we went into schools as part of the mental health support teams, asking young people and children, what do you think we should call the mental health support teams? And it was very interesting there that the children and young people said, oh, we don't mind the term mental health. We're not scared by it, but we think that our families are. And we're concerned that if we come to you and ask for help, and then our family gets a consent form that says mental health all over it, that will distress and alarm our families. So we are in this strange situation where everyone says that they're okay with mental health, but they're concerned that others aren't okay. And I do think that one of the most powerful things we can do as adults, as you said, Nina, is model our okayness with the phrase mental health, with the language around mental health, to show our children that we're not afraid, so that they know that they can use that language without having to worry about us. I also wanted to add that this project is close to the heart of Enfield's young mayor and our youth parliament, and we've been working with them to put together a video for Mental Health Awareness Week in May, which is by young people to young people, aiming to break down the stigma around mental health. So that's kind of one tiny piece of the puzzle here.
Alex, you'd like to add to that?
There we go. Pretty much spoke when muted just then. Thank you, everyone. I just wanted to add to what previous people have said. Actually, I think like the modelling aspect of this, in terms of how are you behaving when you're discussing your own emotions and your own mental health. I think kids and everyone around you is influenced by that. They just are, and we can't expect to have our kids to have emotional literacy and sort of resilience, whatever that word means. We're not demonstrating it ourselves. And then the other thing is, I just feel that there's a humongous amount of pressure on young people at the moment, on children and young people. The pressure to look good, pressure to be successful, pressure to get better grades, pressure to earn lots of money, pressure to decide what they're going to do in their career. So not just have a job that they enjoy, but a career that they're going to be incredibly successful with, and so on. And I just think that perhaps a greater emphasis on happiness would be nice, and that being the greatest form of success. I worry that we put too much pressure on our young people, and every bit of work I've ever done with young people at school age, that's what I hear coming back from them. Is there's a lot of pressure, and I think it's increasing.
Thank you, Alex, that's great. And that kind of leads on to another question we've got about mindfulness, and I think you've touched on that earlier today, and it's like there's a lot of talk about it, but how does it actually help? We've only got a couple of minutes left, so we need to have a very succinct answer. Who'd like to answer that one for me? Emma?
I'm aware that I'm now being scrutinized by the rest of the panel. I hope I get it right. For me personally, I think mindfulness is a way of being in the present moment. When we start to notice our thoughts, quite a lot of our distress comes from living in the past or living in the future. So I might have a tricky morning with my daughter, and then I drive to work rehearsing that tricky morning and thinking about the things she did to make me cross and what I should have said and what I'm going to say to my boss. And in the meantime, I'm missing the fact that the present moment is okay and the sun is shining. And I've put my window down and I can smell the blossom. And I'm not always saying life is full of blossom, but it's a way of bringing yourself back to what is, taking yourself out of your mind and into your life, whether the present moment is neutral, is good or is bad, being in the present moment to give yourself your best chance in your life.
That sounds great, and I think that's something we can all benefit from. Free training for parents to help support their children with their mental health. Yep, please, Nick.
Sorry, I just wanted to come in because I thought Emma's I thought it was a really good description of how mindfulness can help. I also wanted to add, for me, I think there's something about it relates a bit, I think, to some things Alex was saying about the kind of pressures on young people. You know, I think another pressure that we all face is these kind of multiple demands on our attention as well, that we're kind of bombarded with information, with notifications, you know, with kind of things on demand. And we, you know, and there's something about kind of being pulled in multiple directions. And it's quite hard often just to have kind of a more clear, grounded, kind of focused attention, and to feel like you're really sort of in control of where your attention goes. And I think that's another really important way that that I find kind of mindfulness practices help, because sometimes it can almost feel like we're automatically just being pushed and pulled by this kind of bombardment of kind of information. I just wanted to add that as well.
No, thank you, Nick. And I think we are human beings, not human doings. And I think we kind of forget that sometimes, that we just need to be, and that's okay too. So we need to wrap up now. I'm really sorry to say, because we're running out of time. But before we do, we have an evaluation form and the link's in the chat. It helps plan future sessions and improve them, hopefully. So, and one of the reasons we had this session today was based on feedback of previous sessions, asking for more information about mental health services. So your input does make a difference, and thank you. So remember, do contact us at Healthwatch Enfield. That's 0208 373 6283 if you need more information on anything. That's what we're there for. And the information helpline and email address will be in the chat box, which is fantastic. So I just want to say a massive thank you to everybody that attended the meeting today, and especially the panel. You've given your time, and I know you're busy people, so I really appreciate that. You know, we always run out of time with these things, and there's so much rich information given, but you know, there's always more time for another session, maybe later on in the year. So thank you once again, and once again, thank you to everyone that came to the panel for your help and support. And do look on our website for more links and more information for the next sessions. We'd love you to join in as well and get in touch. So once again, thank you very much indeed. Wonderful panel, wonderful information, and have a great day, everybody, and enjoy that lovely dry weather outside. Anything else that anyone wants to say before we wrap up? Yes, Nina, what would you like to say?
I just wanted to add that we have some free trainings for parents on how to cope with their children, and if they are going through stress themselves, stress relief things. So I'm going to put our email address, so if anyone wants to message us, and our phone number, they can call and self-refer. Yeah, that's what
fantastic. I think the message is you're not alone, parents. We're not, you know, there's a load of help and support out there, so please do access it. Don't be embarrassed about it. Get the help and support you need. There's a wealth of it out there. So thank you all once again. You've been brilliant, and have a lovely rest of the day. Enjoy. Okay. Thank you, everybody, and thank you for your time today. Thank you.
Thanks a lot.
Thank you, everyone. Cheers. Bye-bye.
Bye. Bye-bye.
Thank you. Bye.